Things like your phase 2 over here, we kind of talked about some of the subsets in here, but you know, you got glutamine on your micronutrient test also, and then of course looking at the effects of B12 and folate, and then homocysteine as well. So, but that's kind of everything summarized in here. So if you're gonna memorize any slide out of this presentation, that's the one to memorize right there. That's your working slide right there. Okay? If you can grab hold of this slide, you'll be able to work through anything detoxification related. So let's look at some endogenous influences on detoxification. I put this in here because this is the stuff that never gets talked about. Again, this is detoxification is all about the liver, the gastrointestinal tract, and maybe the kidneys, right? Sometimes we talk about lungs and skin, but this is the stuff that influences those systems that is just as relevant as the actual system we're trying to depend on to detox. So looking at the neurotransmitters, we'll look at dopamine and serotonin and just the overall role of the nervous system as it mobilizes between sympathetic and parasympathetic here. And then looking at the different hormones, your thyroid, cortisol, and growth hormone. So if you look at this, the present study suggests that liver cytochrome P, again, phase 1, is regulated by the dopaminergic tuberoinfundibular pathway via growth hormone and thyroid, basically your T3, right? So again, if you look at this diagram, so pretty much in here you got your substantia nigra for your dopamine, and then you're going to get these projections, these dopamine projections out into the frontal lobe. This is the reason that we say someone who generally is having motivation issues has frontal lobe or reduced frontal lobe activity. That's also the person that we need to begin to think about dopamine activity with, right? Because again, what is it? If you look at these individuals, they're just, if they're not motivated, they're generally working at a little bit slower pace, right? So that's where, and then think about thyroid. We always talk about with thyroid metabolism, right? Well, what's the one thing we say to, or one of the criteria we use to help make a diagnosis of hypothyroidism? How often do you have bowel movements? Are you constipated, right? We know hypothyroidism is associated with constipation. Again, if somebody's constipated, can they clear out things effectively? No, right? So this dopamine is a big one. And again, I'm just real simple about this. I just ask motivation, and the other key question I've started asking about this is, do you find that you have a shorter fuse? You're more quick to anger, you have a quicker temper than you used to? That's another good question for dopamine. And again, why would you ask that for detoxification? Well, here's your reason why. The hypothalamus controls liver function. Okay, well, wait a minute, hypothalamus. Wait a minute, hypothalamus, pituitary, we're thinking more like your TSH, ACTH, LH, FSH, you know, those types of hormones. But this is actually saying that it controls liver function here. Not only by releasing those hormones from the pituitary gland, but also by stimulating the autonomic, sympathetic, and parasympathetic projections to the liver. So, think about this. Some of us chiropractors in the room, thinking about sometimes how we'll manipulate certain areas to try to stimulate a parasympathetic versus a sympathetic response. Here may be one of the ways, and you know, you hear sometimes, well, you get improvement, some type of secondary improvement because of the manipulation. You're like, I don't know how that happened. Well, this may be one of the ways that happened, right? Because you're affecting neurological output to that organ system. So now we've got some science to kind of start putting those connections together for us. And again, I mean, if you look at it from a different perspective, forget the whole musculoskeletal manipulation aspect of it. Just telling our patients, hey, you need to go to bed at night. You got to quit staying up. Because what are they doing when they're staying up? They're engaging those sympathetic responses. They're kicking in that cortisol. If they don't hit if they're not in the bed sometime roughly between 11 and 12, I mean, if they're staying up past midnight, that cortisol's coming up. And if that cortisol's coming up, that sympathetic response is coming up. And as sympathetics are coming up, detoxification is going down. Remember, this is an ongoing process. This is something they have to do repeatedly. If we stop detoxing, we stop functioning very efficiently. So let's look at a few more here. This is kind of just reinforcing what 2 slides ago said, but this one's also actually adding in your cortisone here, so your corticosteroids. But basically you're looking at the cytochrome enzymes, and this is just a couple of subsets on those, are regulated by those endogenous enzymes. Okay, that's kind of interesting. Now, don't want to leave this out. You're also looking at the effects of your serotonergic systems. I mentioned the dopamine systems up here, but this is also looking at your serotonin-based systems as well. So a couple of testing options. It really depends on what you want to test. I mean, it's all about how detailed do you want to get with this stuff. If you really want to get into defining things regarding phase 1 and phase 2 and just kind of say, I want to know if one of those two systems is working, you can do that. You can look at this D-glucaric acid or capturic acid. But that's just going to tell you phase 1, phase 2, and how efficient the patient is mobilizing those two processes. You can also look at your SpectraCell testing. We've kind of pointed out a few of these, but I mean, a lot of the nutrients that are involved in the ability to metabolize these different toxins are going to show up in that micronutrient test. So they're on there. So, you know, it just really depends on what you want to look at. And of course, your red, you know, a real red flag would be elevation of your liver enzymes. But definitely, you don't have to have an elevation in these to have impairment in detoxification. That's not a criteria by any stretch. If you really want to go to the next step on this stuff and start looking at breaking down these individual toxins, you can do that. Those tests are available. I don't really know that there's a lot of necessity in doing that in most cases. There might be in some where you know there's a potential direct exposure, but I don't think for the whole that that's a necessity. And then you get into your different heavy metal testings, and actually your porphyrin testing is going to be involved in this as well. Again, there's different opinions about all that stuff and the ways to test it, so you guys can look into that. So therapeutic interventions here. So diet. Paleo diet, modified Mediterranean diet, whole foods diet, I don't care what you call it, just real foods, right? That's the bottom line. Real food is what it's got to be. And I thought about this too. We tell patients whole foods sometimes, just eat real whole foods, and yet you have whole wheat, right? So you have to make that difference to your patients, because they'll think, oh, wheat's all good, and it's good, it's still refined. So, and then your nutrients, of course, your sulfur-bearing amino acids. Just think back to that diagram. Your methylation cofactors, B12, folate. You could also look at things like B6 and how that kind of shuttles down through that transsulfuration pathway into glutathione. Your minerals, I'll show you the more definitive studies on that here in just a second. And then your antioxidants. And then these last three, those are going to be the ones, those actually have some really interesting effects in just kind of supporting overall detoxification processes. But they really have a dual effect in that they support those detox pathways, but they're also going to be protective on those reactive intermediates between that phase 1 and phase 2. So preventing those from building up. If you guys aren't using a lot of these different botanicals in here, there's a lot of research coming out on these two. And this guy right here, even from a musculoskeletal perspective, is huge, right? And then from, you know, if you think about the other big area that a lot of us deal with is metabolic syndrome. Resveratrol is huge in metabolic syndrome. So, real short, quick and to the point on these, right? Out of the Journal of Toxicology. So that's what they're studying. Dietary selenium status is inversely related to the vulnerability of methylmercury toxicity. So if you've got an increase in inflammation, which is causing your selenium status to go down, you're more susceptible to the effects of methylmercury in the environment. Okay? One more reason to keep your nutrient status up. That's also actually a good reason when we're interacting with our patients and our patients tell us, well, why do I need to do the micronutrient test on an annual basis? This is another good thing that we can kind of add to that list. We're being protective of them. We're helping them maintain their detoxification pathways. And now you've got good justification for that. Speaking specifically about those different botanicals there, your curcumin and resveratrol offer protection and inhibition of inflammatory molecule synthesis and nuclear damage from exposure to environmental toxicities. It's pretty cut and dry, right? No real guessing or extrapolation in that information. I mean, that's just straight to the point. So let's summarize this really quickly here. So our toxins, they're ubiquitous in the environment. We're not going to run from them. And bottom line is we could lock ourselves in a bubble and still get everything that we need. Our body's going to produce them anyway for us. So we're not running from them. So if you can't get away from them, you got to make sure that your clearance pathways are efficient. Right? Due to the ongoing nature of detoxification, we must ensure that the necessary cofactors are in place to support each physiological step. Again, we tend to talk about this as as a subset of the rest of the way that our body functions sometimes. But again, detoxification is occurring on a day-to-day basis. It's an ongoing process. It's never stopping. You're really looking at, when we talk about this, biotransformation. You guys see now, as we've gone through this, why there's a difference in just using the term detoxification and why biotransformation might actually be a little bit more of a descriptive term for it. You want to consider all your endogenous mechanisms that affect biotransformation. Again, we have the beauty of having those tests that really answer those questions for us, so we can kind of hone down on that. And if you can test, test. Don't guess with your patients. Test it. And I'm probably preaching to the choir and making that comment in this room, but you know, black and white is always better than a whole lot of gray, right? So, what questions does anyone have?
Hold on, I gotta break mine.
Oh, all right. Actually, I'll real comment on that real quickly. There's a slide there at the very end that's not on the presentation. That's just when I was putting some of this stuff together. It's really just talking about the different phases and kind of looking at the, you know, if you look at phase 1, the oxidation, reduction, and dehalogenation, it's just looking at the subsets of chemical reactions in those phases. So it's just repeating some of the stuff we said earlier.
Back to your slide on page 8, it's on the iron deficiency. You mentioned that if a patient's iron deficient, then they're not going to be able to perform detox in a normal pathway. If you get an anemic patient, do you normally fix the anemia before if they need, like, say if you think they need a full detox program, do you normally fix your anemia prior to, or as long as we're supplementing it as we go, would that be adequate?
The generic answer to your question is concurrently. I would do them together.
Okay.
I wouldn't differentiate them. I would just go ahead and, as you're repleting the iron, go ahead and do your detox. But you may just want to make a clinical decision on that. If it's a really, I mean, let's say you got a ferritin under 10, you know, a really bad one, then you might want to give them the iron for, say, 2-3 weeks. I think it's really a clinical call in those scenarios, but in general, I don't see any problem in doing them together.
You mentioned something about grapefruit earlier, because I was doing some other reading. Okay, are they recommending grapefruit or not during the detox process?
It was actually grapefruit juice, I think, is generally what they recommend on that, because you got a higher concentration. But you know, some people want to do like a grapefruit diet or something like that. I know that's not very popular anymore, but it was at one time. And some people might, you know, misinterpret that and incorporate that in as part of their detox process. So I would just be conscientious about that, because, you know, obviously, especially if you've got somebody on medications and you're trying to support these detoxification systems, you're going to change the pharmacokinetics on those medications a little bit. So you got to kind of think through that a little bit. So.
With the tours of big one, if they don't want me to take,
I mean, other than telling you it affects the cytochrome P450 enzymes, that's the mechanism I know on that. So. Anybody else?
A couple of questions about bowels. Does the quality of the bowel movement affect the detoxification program? So if they've got gastritis and they're having, you know, because you said, are you having a bowel movement every day? Well, they might be having 4. It's not necessarily good ones. Does that affect anything with detox?
It does. You definitely want to ask about the characteristics of the stool when you're trying to get a better insight on whether that's going to actually facilitate the detoxification process. Because if they don't have a bulky, well-formed stool, they probably don't have really adequate fiber, and they're probably getting bowel movement, like in the scenario you're talking about, they're probably getting bowel movements more as a result of a neurological impact or as an irritant. So they're really not allowing those toxins to have anything to bind up into effectively. And
going to the other end of the spectrum, I've noticed that patients who have chronic constipation, if we put them on a detox program, they have a much harder time. And I'm guessing it's because they've got a bigger toxic load.
If you've got a patient who is constipated and you put them on a detox, they're having a harder time.
Yeah.
Right. Okay. So now maybe, you know, kind of going back and looking at some of those endogenous influences we talked about. Maybe going back and thinking about the input or the impact of the thyroid or the dopamine pathways. Those might be, say, like you do some support for that for a month, and then you come behind them and do the detox. because they've got to eat, right? And we know that the diet has a detoxification role. So maybe start them into that detoxification process with the diet and the dietary changes, and then after you've supported and kind of got their constipation worked through a little bit, then come back and do more along the lines of what you're thinking about as being a full-blown detox program.
Okay.
Right? And let me actually make that comment really quick, because this is a point of differentiation, because I hear practitioners say sometimes, we don't need a detox. You know what? I kind of agree with them. You don't. But you do sometimes too. And the way I clinically use detox is that the point I think they make is that you're setting the wrong frame of mind for the patient, because you're giving them an expectation of a 28-day, I'm just using 28 days, a 28-day detox, and then at the end of that, then that was what they did for 28 days and now they go back. That's not the way to use a detox process. You use a detox to set the frame of mind for the person you're working with, to get them on board and to see how beneficial those dietary changes can be. The supplements in this scenario are really ancillary to fill in the gaps. It's the diet that makes the huge difference here.
You're tripping. Like you did us.
It was all in your best interest. All right, does anybody have anything else? Okay, so I know the other two topics that we wanted to cover are neurotransmitters and hormones, right? And we'll definitely get to those. I'm going to put this out there, okay? If anybody else wants to speak on the topic, I am more than happy to trade places with you. I am spending my life building PowerPoint presentations right now. So
Everything's so good.
Thank you. But I will be more than happy to share the floor with somebody else to let them talk about something else. But those are the two things that are definitely coming, okay?
Thank you.
Appreciate it.